Bismillahirrahmanirrahim. So the next topic of our discussion is childhood polycystic kidney disease. So childhood polycystic kidney disease is also characterized by the formation of multiple cysts in both kidneys. The inheritance pattern is autosomal recessive, unlike in adult polycystic kidney disease where the inheritance pattern was autosomal dominant. So childhood polycystic kidney disease is further divided into 4 subtypes depending on the age of the discovery of the disease. The first of all is the prenatal, which is before the birth. So the disease is discovered on the prenatal ultrasound, which demonstrates the presence of multiple cysts in the fetal kidney. Then there is neonatal age. The neonatal age is from birth to the first 4 weeks of the life. The next is infantile, which extends from birth to first 1.5 years of life. And the disease discovered during the infantile age is known as infantile polycystic kidney disease. The next is juvenile, which means pre-reproductive independent age. Prenatal and neonatal polycystic kidney disease is the most common subtype of the disease. Coming on towards the pathogenesis. So the gene involved in the pathogenesis is PKHD1 gene. The gene encodes a protein known as fibrocystin protein. The fibrocystin protein along with polycystin protein constitute the cilia of tubular cells. These cilia protrude in the lumen of the tubules. So the mutation in PKHD1 gene results in the defective synthesis of the cilia and ultimately results in the formation of cysts. Coming on towards the morphology, the gross appearance reveals large size of the kidneys. Unlike adult polycystic kidney disease, the external surface of the affected kidneys is smooth. The cut section reveals small cysts present in the cortex and medulla, giving the kidney a specific sponge-like appearance. The histological picture reveals dilation of the collecting tubules in a cylindrical or less commonly in saccular pattern. The insides of these dilations are formed by the cuboidal cells. The presence of cuboidal cells in these cysts indicate the origin from collecting tubules. In almost all the cases of childhood polycystic kidney disease, liver cysts are present, which are also associated with the presence of portal fibrosis. So the prenatal polycystic kidney disease results in renal failure before birth. Liver disease is commonly present in childhood polycystic kidney disease, which results in periportal fibrosis, causing splenomegaly and portal hypertension. The prenatal ultrasound reveals presence of cysts in the fetal kidneys in prenatal polycystic kidney disease, and there is also lungs complications. There is a specific feature of infantile polycystic kidney disease, which is known as the Potter sequence. So the amniotic fluid is formed from the urine, and since there is decreased urine formation in polycystic kidney disease, hence there is decreased amniotic fluid. So this amniotic fluid is insufficient to completely fill the lungs, and the lungs remain underdeveloped. Potter sequence is most commonly seen in infantile form of polycystic kidney disease. The treatment is always symptomatic and requires dialysis at early age. Renal transplant is so far the best treatment option for polycystic kidney disease. So this concludes our section about polycystic kidney diseases. If you have any questions, do let us know in the comment section. Thank you.